Okay, now we're going to mobilize this patient's patella. So I have her in sitting. This technique is chosen because it's a good technique to use for stiffness in the patella, especially after periods of immobilization. She had a cast boot on, so she was probably pretty immobile for a while, 8 weeks. So I've got her in knee flexion. My leg is stabilizing her in the position that I want her in at her limit of flexion. I'm going to cup her patella in my right hand, and the heel and ulnar border of my left hand is helping to just kind of give it a downward caudal glide in the longitudinal direction. And I'm doing it as she's getting some knee flexion, and I can give her some compression using my right hand here. So I would just kind of move her over here. And if I wanted to do grade 3, I would just try to go to her limits in a large amplitude. Okay? And the grade 4 would just be bringing her to the end of the limit and doing small amplitude, keeping her in flexion. But I think it's a little bit harder to do graded mobilizations on the patella. I'd like to feel that. And that's how I'd kind of mobilize her patella. And I could also do some variations with that, as I could try to do some medial and lateral movements, move my hands and try to keep her in flexion. I could even go caudad with it. When she's in flexion, get a little stretch there. Thank you. Now I'm going to address the patient's lack of medial and inferior glide, again at the patella. I'm going to do her in supine, open pack position of her knee. And so I'm going to have her try to relax, and I'm just going to kind of assess her inferior glide. Relax your leg. So I'm just taking her through a little bit of the range. And I'm trying to kind of pick up her patella here and then glide it down. And so what I would do if I was a grade 1 would just be barely moving. And then grade 2 would be partway through the range. Grade 3 is what I would use for treatment. And then a grade 4 would be just keeping her down in the end of the range at her limit and just trying to give her small amplitude mobilizations at the end of her limit. And then to address her medial restriction, I would come around the side here, and again I would just kind of assess her range. I'm using kind of my pads, my thumbs here. I'm going to try to lift her patella a little bit. Try to relax, honey. Lift her patella a little bit, and so like a grade 1 would just be just barely moving it. A grade 2 be halfway through. A grade 3 would be into the limit. And then at grade 4 would be I bring her to the end of the range, and then I would just do small amplitude in the medial direction. So that would be my inferior and medial patellar glides. Thank you. Okay, so now I'm going to mobilize the patient's ankle. She's lost 50% of dorsiflexion, plantar flexion, and inversion eversion with a high ankle sprain, lateral ankle sprain. So first I'm going to start with plantar flexion. So I'm going to just kind of assess her range, bring her into plantar flexion here. I'm going to do a grade 3, mobilize her here. My left hand is grasping her down by the talus, just distal to the malleoli. And I'm going to give her a grade 3. And then I'm going to go ahead and give her a grade 4. The end range, working into that resistance. And I'm adding a little bit of physiological plantar flexion along with the accessory motions. Thank you. So you can stop. Okay, now we're going to work on increasing the patient's dorsiflexion. So I'm going to do some physiological dorsiflexion. And my right hand is grasping just distal to the malleoli again. I'm kind of mobilizing her talus. And we're going to do a grade 3 anterior posterior glide. And I'm adding a little bit of physiological dorsiflexion as I'm mobilizing here. And then I'm going to go ahead and bring her to the end range and give her a grade 4, so small amplitude, working into that resistance. And that was a grade 4, so grade 3, 4, anterior posterior mobilization for dorsiflexion. Thank you. Okay, now we're going to do a transverse movement of the subtalar joint. This is to help her with her inversion eversion. So my proximal hand is stabilizing just at the medial talus, and the heel of my left hand is going to be the mobilizing hand, and I'm just going to do a downward lateral glide here. So I'm going to do a 3-4, so here's her 3 into the resistance, large amplitude. And then a grade 4 would be I'd take her into the resistance and I'd do small amplitude into the resistance. You okay? Okay.
It hurt.
And then she tells me it hurts, I would back off a little bit.
Is that the end of that one?
That's the end of that.